Several years ago, I was in my residency training program in Indianapolis, and my brother was living on the East Coast playing collegiate basketball. He had a relatively minor surgery on his patellar tendon while he was there, and about a week or so after the surgery, he went back to the trainer complaining of some swelling in his leg. The trainer said, "Well, that's normal, you just had surgery." About a few days after that, he drove from the East Coast to Indianapolis to visit us. When he arrived, his leg was very swollen and painful. I looked at it and was concerned. My wife, who is a registered nurse, looked at it and said, "You should immediately go to the emergency room." A few years later, I was in my practice, and this was several years ago. A patient had a lumbar fusion, and surgery was uncomplicated. It went very well. A few days after surgery, maybe a week and a half, he called the office complaining of shortness of breath. I happened to be standing next to the nurse taking the phone call. The patient, I knew, had played professional basketball and was coaching at the collegiate level. It was not typical for someone like him to have shortness of breath. And I suggested, after overhearing this conversation, that he immediately go to the emergency room. What do these two patients have in common, and why were they appropriately recommended to go to the emergency room with a swollen leg and shortness of breath after surgery? One of the complications that can happen after surgery is a deep venous thrombosis can form in the leg and then break off and travel to the lung and become a pulmonary embolism. Pulmonary embolism is a life-threatening problem. Because of surgery, the stress of surgery, the body trying to form a clot to prevent bleeding, deep venous thrombosis can occur. Another reason why deep venous thrombosis occurs after surgery is because the patients may not be as active after surgery as they usually are. Sometimes patients have a predisposition for clotting that they don't even know about going into surgery. There are two things I want to go through that are important for every patient to recognize when it comes to deep venous thrombosis and pulmonary embolism. The first is prevention, and the second is detection or diagnosis if it happens. As far as prevention goes, leading up to surgery, you want to stay active as much as possible and have good nutrition. During surgery, we try to be efficient with our time under anesthesia, and the patients wear sequential compression devices on their legs during the operation, which squeezes the legs and triggers the blood flow and has been shown to help prevent deep venous thrombosis. If a patient is admitted to the hospital, they continue to wear those compression devices while in the hospital. Another form of prevention, and maybe the most important, is that we want the patients to be up and moving shortly after surgery. In some cases, we will use a medication to prevent blood clotting, such as Lovenox, given once a day for maybe a couple of weeks, especially if somebody is not very mobile after surgery or has a high risk that is known for the formation of a clot. The second is detection. Swelling in the leg, like my brother had, or shortness of breath, like my patient had after surgery, are two important clues that there may be a deep venous thrombosis or a pulmonary embolism. Other symptoms may be heart palpitations, chest pain, a general feeling of not being well, but I think the main two things to remember would be swelling of one of the legs, maybe both, but specifically one leg, and then shortness of breath in the postoperative period. If a patient or if you have one of these two significant symptoms, it's important to seek immediate evaluation. My brother, when he went to the emergency room, was found to have a large clot in the vein, and he did not have a pulmonary embolism. He was started on medication and the clot went away. The other patient went to the emergency room and was found to have a fairly extensive pulmonary embolism. He was admitted to the hospital, was treated for the pulmonary embolism, and made a complete recovery. Because of prompt diagnostic evaluation and treatment, both of these patients made a good recovery. It's our hope that our patients can prevent deep venous thrombosis and pulmonary embolism through the mechanisms that I suggested, but also that if there's any concern for deep venous thrombosis or pulmonary embolism, to seek immediate medical attention and to do the diagnostic evaluation, because it is a life-threatening problem.